Bismillahirrahmanirrahim. Today I will give a mini lecture or a short presentation on clinical triads and their relevance to medical diagnosis and surgical diagnosis. I only want to pay attention of physicians in the emergency room dealing with acute cases in clinical practice, whether medical or surgical cases, to pay attention to the following. Don't forget the what we call the Murphy's triad and the Dieulafoy's triad in patients with acute appendicitis. These are important clinical triads. I already talked about them, by the way, in my 5 episodes covering the issue of clinical triads in medical diagnosis. And just a reminder and to give a small review of what I mentioned and spotlight on certain important points that don't forget Murphy triad and Dieulafoy's triad in patients with acute appendicitis, especially acute obstructive appendicitis. I mentioned them. Don't forget and don't confuse the Mackler's triad of Boirav syndrome of esophageal rupture, thoracic esophageal rupture cases, and don't confuse it with the Anderson triad of esophageal rupture in its abdominal course. So Anderson triad refer to clinical triad in patients with abdominal esophagus rupture, and the Mackler's triad refer to Boirav syndrome of thoracic esophagus rupture. So don't confuse and don't forget these two important triads, the Mackler's triad and the Anderson triad related to esophageal rupture, whether thoracic or abdominal. And don't forget the Murphy triad and Dieulafoy's triad in acute appendicitis. And don't also forget the triads, what we call the extrarenal triads described in patients with hypernephroma, renal cell carcinoma. I mentioned them. And Stauffer syndrome, paraneoplastic hepatic dysfunction in patients with renal cell carcinoma. And also triad, I mentioned it in patients with hypernephroma, the fever, the refractory anemia, and the hyperhepatoglobulinemia. And please don't forget also the medical triads in pulmonary disease, especially Cartegner syndrome triad, the Pancoast tumor triad, the allergy, the respiratory allergy triad, and also in the cardiology field, the PEX triad of cardiac tamponade and the aortic stenosis triad and the congestive heart failure triad. And in the endocrine field, don't forget the Graves triad, suggestive of Graves autoimmune disease or Graves thyrotoxicosis, and this Graves triad. And don't forget the Whipple's triad of insulinoma syndrome. And don't forget the acute Addisonian crisis or acute adrenal failure triad of hyponatremia, hypoglycemia, and hyperkalemia in patients with acute adrenal failure, Addisonian crisis. And don't forget also the Plummer-Vinson syndrome in hematology, the Plummer-Vinson syndrome, patients presenting with iron deficiency anemia, dysphagia, and esophageal webs. And don't forget the clinical triad of hemolytic uremic syndrome. And don't forget the Melzer triad of cryoglobulinemia syndrome. And in the rheumatology field, don't forget the Wegener's granulomatosis or polyangiitis and the granulomatosis triad, and the Reiter syndrome triad also in patients suffering from seronegative spondyloarthropathies, the Reiter syndrome triad. And don't forget also in the nervous system, the Gradiningus triad, the Horner syndrome triad, the opioid overdose triad, the Cushing triad of increased intracranial pressure in patients with cerebral edema complicating head trauma. And don't forget the hemolytic uremic syndrome triad versus the thrombotic thrombocytopenic purpura pentad. Don't forget the triad of Henoch-Schindler purpura, which is IgA vasculitis, anaphylactoid purpura, or hypersensitivity vasculitis syndrome of Henoch-Schindler. That's a famous bleeding disorder with its clinical triad. And don't forget the nutritional deficiency triads of biotin deficiency, the kwashiorkor deficiency, the pellagra triad, and also other vascular disorder triads like the Virchow's triad of venous thromboembolism and deep venous thrombosis, the famous Virchow's triad. And don't forget also the Behçet's disease triad. I mentioned it, and it's very important in clinical practice. These are some of the most important clinical triads related to medical syndromes and surgical syndromes, and try not to confuse. Some of these triads are described in one disease. As I mentioned, in acute appendicitis, the Murphy's triad and Dulafoy's triad. In esophageal rupture, the Mackler's triad versus the Anderson triad. And this is examples of triads as a part of the clinical picture of one disease. And in addition to the other clinical triads which I mentioned, it is a group of symptoms or signs related to damage to 1 to 3 organs and characterizing a specific medical condition or a disease or a syndrome, whether surgical or medical. Thanks so much. This is just a reminder, and I will continue tomorrow talking about the clinical tetrads. That is the combination of four clinical symptoms and signs which characterize a certain medical condition or syndrome. And then after tomorrow, I will talk about the pentad, clinical pentads in medical diagnosis. Thank you so much. Have a nice day. Have a great day. And stay alert and stay peaceful and stay safe, please. Thank you so much.